Hi, my name is Jennifer Palmer, and I'm the owner of Nourishing Journey. I spent many years dealing with chronic health concerns, and I used to be a computer programmer, and I was told that my health concerns were pretty much the way it was going to be the rest of my life. And I didn't really want to hear that. So I went on a mission trying to find anything and everything that could help me feel better. And not just me, it was for my family too. And I did find some answers. And honestly, I feel better now than I have ever felt my entire life. You can feel this too. People that you know and love can feel this. You can heal. The body knows how to heal. We just need to know how to unlock it. And while none of us have all the answers, many of us have many of the answers. There's many, many, many things you can do to help your body, mind, and spirit. So we're just here to give you some of the different answers. We hope that you enjoy these roundtables. We're going to be covering a lot of different topics. And the goal is just to try to help you see that there's possibilities. But if you think that we can be of service to you, and if there's any way that we can help you, there are links in the description where you can contact us. And we hope to hear from you soon. Enjoy. All right, guys, here we go. This is our roundtable on pain. What I want to do is I want to take a moment to just introduce who everybody is in the roundtable today. And I'm going to start with Karan. Go ahead and tell us who you are.
Karan Almond, and almond is spelled like a nut, just in case anybody wants to know. So I am an oral systemic consultant. I kind of marry dental health with systemic health because there's a lot of crossover with systemic symptoms that may be relative to your oral health. I'm also a certified cellular and dental detox practitioner. I work with BioResonance, and I'm a human design guide.
Beautiful. Alice, tell us about you.
Hi, I'm Alice Tsai. I'm an integrative medical doctor. I've been practicing for over 25 years. Now I focus on lifestyle, integrative medicine for adults and children. And I like to do natural methods, functional methods, homeopathy, medical cannabis, and other and MindBody things, other natural things to heal.
Beautiful. All right, Maria.
Hi, I'm Maria Petrucci, and I am a chiropractor. I help people mostly with different kinds of pains in their body as well as stress. And the stress part comes in a lot when I do CranioSacral therapy, which really relaxes the body. And I also use some mind-body tools in the equation.
Beautiful. Nina.
Hi, thank you for inviting me here. My name is Nina Evangelista. That's evangelist with an A. and I'm a physical therapist. That's my background. In addition to treating orthopedic conditions, I, in the recent years, have fallen in love with supporting pelvic health conditions. Dealing with both acute and chronic pain conditions as well. And I'm also a Tai Chi for Health instructor. So that is my mindfulness movement. Thank you.
Beautiful. All right, so I want to start this discussion with a good understanding of what chronic versus acute pain is. And I was thinking I'd like to start with Nina, since you deal with it day in, day out. Why don't you tell us a bit about what you see and what you know about chronic versus acute pain.
Versus acute pain. Thank you. So yes, acute versus chronic pain. Just for timeline purposes, and of course, you can all chime in as you all are experienced with treating chronic and acute pain conditions. Just for timeline conditions, anything that has any pain that has exceeded about 3 to 6 months, please do correct me, is considered chronic pain, something that you have dealt with, not quite like an ankle sprain. So when I always use ankle sprain as a very common example of what acute pain is, because it's something that has a mechanism of injury, something that has transpired, and then you see the symptoms of swelling, of redness, of warmth in that area, say, for example, your ankle. And chronic pain is something that you have been dealing with for a significant amount of time, and that becomes a little more complicated than treating an ankle sprain. So just for that, in that specific bit, that is what's the difference between acute and chronic pain in regards to timeline. And again, it becomes a lot more complicated because it can be something that you've been dealing with for your entire life or for a significant number of years. And you can somehow, there's a level of difficulty tracing back to how it came out to be. And I'm a physical therapist, that's my background. Like I said, I deal with, typically people come to me when they are in acute pain because they can recognize the pain and it's definitely limiting their function. So they come to me because they were referred by a physician, for example, because the doctor thinks they will benefit from physical therapy to heal from that acute condition. I'm very, how should I put it? In 2016, I think this is when it started. I realized that acute pain is always when people would come to me, and then I would help them return to their function because they heal from that mechanism of injury that had transpired. And then I'm helping them return to function. And just to kind of put things into perspective about how I recognized, hey, this can sometimes not necessarily be just an acute pain that I'm dealing with. And that kind of made me felt stuck, like really stuck in that specific year, I recall, because I feel like there's something missing. Somebody coming to me with an ankle sprain, it just doesn't quite, make sense because it's so difficult for them to jump from returning to recovery. So I make them be able to walk again or maybe jog. But then again, after I let them go and discharge from my care, the dreaded discharge, then a year later or 6 months later down the line, they come calling back and they say their foot's hurting again, and they don't understand what's going on. So from that point on, I kind of tried to discover other ways. Why is it that my client is not able to maintain that pain-free ankle and eventually become, ultimately well and not have to come back and forth to physical therapy. So anyway, I don't want to take up so much of everybody's time. This is like I know it's a soapbox that I really want to, I continued to learn from, discover, and now I have evolved in my practice to make it more of a lifestyle-based physical therapy, combining integrative approaches and mindfulness and all that. Learning that acute pain versus chronic pain is not a whole, it's not just a simple timeline issue.
Right.
There.
Right. I love that.
Thank you.
All right, Maria, tell me a bit about your experience with pain and how you deal with it more with the chiropractic and adjustments versus CranioSacral and the difference for you between chronic and acute pain. And sometimes I wonder, outside of an accident, is there such a thing as acute pain? Just like what Nina was saying, I think it goes so much deeper. Tell me a bit about how you approach things.
Yeah, a lot of it is similar to what Nina said. But my focus is on alignment of the body, but also to keep in mind, I think people need to know that the alignment piece has to do with taking pressure off the body in different places, and it also affects the nervous system. So the chiropractic piece, the crux of it has to do with the spine, but we also treat all the other joints as well. So what happens is a part of the body gets stuck and it's not moving well. Actually, let me kind of go back a little bit. What Nina said about acute and chronic, same experience. With the chronic, there's a lot more complexity to it. That's part of the reason why I use nutrition as well in my practice, not as much as chiropractic, but homeopathy and other things, because it's, your whole body works together. You can't really separate it out. So the piece of it with chiropractic has to do with making sure the nervous system is working well. And if we're bent over forward or to the side or whatever, we're not standing or sitting up straight, that puts pressure not only on our nerves at the spine and the joints, but also with the organs too, the heart and lung, intestines, and everything else. So one of the reasons we want to have good posture is to relieve that pressure. And going back to the nervous system, it takes the pressure off of the nerves so that the brain can send signals to the rest of the body and vice versa. And also the chiropractic influences the blood and the lymph as well, because it's very anatomical. Out from the spine on either side, we've got blood vessels and lymph too, so it really affects your whole body. And as I'm talking here, I'm thinking about how it's a matter of opening up the nerve flow as well as body fluids. We always need to be moving those fluids, getting the nutrients in our body and taking away waste products. So that's a piece of it as well. Yeah, people tend to, like Nina was saying, people will get well or advance to a certain point and then they'll stop coming in. And then a lot of times what I'll see is they'll do something that stresses their body. Like I said, when you, with your posture, if you're leaning forward, working at the computer all day long, it's going to affect your back and your neck and everything else. So, our lifestyle is very important too, getting enough exercise and getting us moving around and eating the right foods. It all comes together.
Yeah, it's interesting. As I'm sitting here thinking about what you're saying and the value of movement of all things, movement of the body, movement of the fluids, but also movement of the energetics as well, which I know we'll talk about soon in this conversation. But energy needs to flow. If it's not flowing, everything gets stuck and can cause a lot of pain. So yeah, it's fascinating. We are bodies in motion. We are meant to be in motion. And so important.
Mm-hmm.
All right, Karan, tell me a little bit about your experience with pain and how you tend to approach it.
So I'm not really a teacher by nature. I help educate people by sharing. So I'm going to share my experience with pain, because if I don't have an experience, I really don't know about it. I can learn about it in theory, but I have a lot of practice where pain comes. So mine came after a nursing injury, which was an acute injury, causing spinal cord compression from a herniated disc. But I had pain my whole life. And, of course, when I went for treatment, everything got focused in on this injury, and all the treatment was for this injury. And of course, when you have acute pain, narcotics, sometimes if you're in a car accident, your pelvis is crushed, you might need a narcotic. What I came to learn is that I really didn't need a narcotic, but they put me on high dose narcotics. So I had a perfect storm, because once I began to understand that I had like Nina was saying, I had a layering. I already had chronic pain before the acute pain happened. It just didn't stop my function. But I had been going to, chiropractors and CranioSacral and Rolfing for years, and it all helped. But I wasn't, for me, getting to what was underneath that for me. And what I came to realize is that I was toxic when I was born. My mother had a mouthful of amalgams, and she had also been exposed to aflatoxins because our family had a farm and there were aflatoxins in that grain bin that eventually made other people in the family sick, but it took years to figure out what that was. So I was toxic when I was born, and I had pain as a child, terrible pain as a child, but they just called it growing pains. And then I learned to deal with it. You learn to cope. Eventually, the pain becomes a background noise. And we really kind of glaze over that and go, oh, I woke up and yeah, my knee's hurting, but I'll work it out during the day. And it kept changing locations on me. And I now understand that's because toxins change locations in the body. Once you get one area flushed out, then you have another area that, because you still have these circulating toxins that are parking themselves and unparking themselves in the body. And so my experience with pain really forced me to learn about you can have an injury, but then you can have a centralization of that pain response where you may get a noxious stimuli or a non-noxious stimuli and end up having what feels like acute pain because the body, the messaging system in the nervous system. So the example for me is if I go put my hand in the freezer, now I still have this, it's better now, but if I go pull through my freezer to get something out, my hand will literally burn like I've touched an oven. But if I put my arm in the oven to get something out, I'll pull my arm out and 15 seconds later, I'll feel the burn, but I don't feel it for that 5-10 seconds, however long my arm is there. And I have a much worse burn. So my nervous system still has not fully recovered. And so what I believe is that the pain signaling in the body gets messed up, and the hands-on things are amazing to help relieve all that. But with what I do, I take everything to the cellular level. We say, fix the cell to get well. Everything that happens in the body, every system that's messed up, every single biochemical reaction, and that's what takes place. You have to have some sort of biochemical reaction in the nervous system to tell your brain that you have pain. When all of that is messed up, then we only have a sensation of pain. We don't always know exactly where it's coming from. So I believe that the underlying thing under chronic pain has to do with toxicity. And that can be even in the foods that we take in. If I eat seed oils, I can go eat the best meal. But if something is cooked in canola oil, I will have pain the next day. And so for me, I love the other therapies to help people stay functional. But I think that getting underneath all of that to what's really causing the hiccup in the centralization of that pain is kind of next level. And it was for me. And I now know that for me, there's food is one of my number one things. If I don't feel well, the first thing I'm going to look at is what have I put on, in, and around my body in the last 36, sometimes 72 hours. And the reason I say that is because a lot of this pain, a lot of the issues of pain start in the gut with leaky gut. And if you eat foods and you have proteins that go back through your gut wall, then you may have what you think is arthritis, but it may not be true arthritis at all. You've just got these large proteins attacking your joints. And so it's the food I take in and the chemicals and it's everywhere. We can't avoid it. You cannot be toxic free, but it's also stress for me. If I am stressed, I will have pain. And that's just how it shows up in my body. But I've also learned to flip that to where pain isn't necessarily a bad thing. It's an alert. And we can now check people's gut transit time. And even though people are eliminating every day, we're finding that some people have a transit time from the time they eat the food till they eliminate it of 72 hours. It should be 18 to 24. So when those transit times are slow, people are brain foggy, they're more stressed, and they have their immune system is struggling. And when your immune system is struggling, you create all these cytokines, and then you have all this pain. So it's almost like this crazy feedback loop in my mind. Like I wish I could get an animation somehow so that people could see how I see it in my head. I know Maria can probably identify with that. It's this crazy feedback loop where there's so many layers to unraveling it, and there's much more to it. If you really want to be out of pain, it's not just one thing that you do. It is really changing both your mindset and your lifestyle if you really want to get rid of your pain. That's how I see it.
Totally agree. Maria, you had something to add to that?
Yeah, I just wanted to give a brief example, talk about toxins. One of the simplest ways of helping, I mean, I know it can be more complex than this, but one of the simplest way of helping is to drink more water. I used to get bad headaches like 4 days a week or whatever. And one of the main things that started me healing myself of headaches was to drink a lot of water. Really made a huge difference. Also, just a kind of a side note, I had a patient who recognized that whenever he ate too much sugar, he would have low back pain. So he'd come and see me, and also just, it's kind of like he was ready whenever he ate too much sugar.
Yeah.
I know I'm gonna have back pain. So it affects, sugar affects people differently, of course. It's just one example.
Yeah, I
Yeah,
can't.
I just want to add one thing to that too. It's like people do not realize how we have kind of evolved to be chronically dehydrated and not understand how dehydrated we are. And also, if we're drinking dead water, there are ways to charge your water so that you're getting more benefit from the hydration.
Yeah, that could be a whole nother topic that we have a conversation
Yes.
about.
Water. There's a whole books on water. Who knew? They're amazing.
All right, Alice, tell us a little bit about you and your experience with pain and how you help people.
So kind of going back to the original question of acute and chronic pain. So first of all, I like to think of pain as sometimes I feel like the view is just, obviously it feels bad. So nobody wants to be in pain. So it's like, how can I get rid of this? You want to relieve the symptoms. And certainly we don't want anybody suffering, but foremost, it's a warning signal, So that's what I think of it as. And then the acute would be like some kind of situation, like Nina's example, like spraining your ankle, or you step on a thumbtack, stick your hand in the stove, like Karen was saying, and ooh, but we need that, right? So it's like, if we didn't do that, then we would be seriously hurt. So it's something to listen to. And so it's not necessarily in and of itself a bad thing. And then, so in an acute situation that happens, and then you get all the swelling and inflammation and all that. But that in itself is also, nature in its wonderful miracle is that's what brings the blood cells and the healing and everything to the area. So even if you think of, if you cut yourself, it's not really that complicated. It's like, you don't have to do anything and your body's amazing and it'll heal it. So acute pain's kind of like that. So it brings all the inflammation, does the healing, and it goes away. Chronic pain is a little different. So that's when there's pain, but then it just doesn't go away like it should. So you just have this inflammation all the time. And I think that is much more complex. And then, like everybody else was saying, it's multi-layers to it. Each person is going to be unique. So it's like you're going to have to see what's contributing to the chronic pain in each person. But it still is a signal. So I still see pain as a sign of something to pay attention to, not just to cover up. So then you get on your detective hat and you're like, well, what's the cause of it? What's the cause of this? Like, I had a patient, before I became the integrative doctor, I was a pediatrician for many years. So I had a patient who had really bad eczema, So like, of course, it's like, who likes skin that's all covered with rashes? Of course, the typical treatment is steroids, stop the inflammation. But it's like your body might be reacting to something. So that particular parent found out, oh, my child's sensitive to egg. And so when they realized that, they avoided egg, the eczema got so much better. So it's like they could use the whatever to get rid of the rash, but really, if you can find out what's causing it, you can help it a lot better. So for chronic pain, I think of that as something where the pain is just ongoing, and it's we talk about how the acute, it has a therapeutic value, but when it's too long, then it becomes maladaptive, and then it causes a lot of suffering. So ultimately, that's what I want to help my patients achieve, because, I think we all have special gifts, and then pain kind of interferes with that. So whatever your gift is, whether you're, raising beautiful children to be great citizens, to do amazing things in the world, or whatever your special gift is, it's like, how can I, help someone to feel better? So for chronic pain, then you really have to start digging in, and that's going to be unique to each person. But like I like to do a foundation. So my love is just figuring out what creates health. Like, it's like that was what I was finding in it. Like, instead of just treating the symptoms, it's like, what can we do to the body to really restore health? And so now there's this science of epigenetics, where our bodies are genes, so that's what makes us all unique. So you can think of genes as your recipe book, okay? But then, or your blueprint of your house. But then the outcome is determined by which recipes do you choose to make. It's like, am I going to make the salad recipe, or am I going to make this chocolate chip recipe and eat it every day? Or the blueprint of the house, how do you execute it? So it's like, that's what epigenetics is the expression of your genes. So what we're finding is that your lifestyle factors and how you choose to live your life, the foods you eat, the stress in your life will have powerful influences on how you express your genes. And then this goes to chronic disease too, like whether you develop cancer or autoimmune disease, or say diabetes, something runs in your family. It has powerful influences. So I think for someone dealing with chronic pain, it doesn't have to be that complicated, like lifestyle factors are, how do you eat? How do you move? How do you sleep? What are your social relationships, stresses, environmental factors? And there, I myself, there's things I could do better. Like I love studying health, how to be healthy, but I'm constantly learning. So even I know myself, there are things that I could improve. So everybody can improve. So if you're suffering and you're in pain, how can we fix these kind of things? So that would be an approach. But there's also approaches where we could talk about the diet, ways to improve the diet, improve the microbiome, the gut health, because those play an important factor in pain as well. So from pain standpoint, there's also inflammation too, right? So anything that you can do to decrease inflammation and all those lifestyle things, but even our diets and things like that can help with inflammation. So those are some of the things. And then in terms of relieving the symptoms, some of the areas that I've studied are, after I started the integrative practice, I got the certification in homeopathy, which I really, really love homeopathy. It uses natural substances, and it's several hundred years old, and it uses them in super dilute amounts. That's what I love about it, because it's so dilute that it's very safe. It can be used with other medicines, and it's effective. So homeopathy can be helpful for pain. And then also medical cannabis can be helpful for pain. And then functional medicine can be helpful for pain. For example, like the patient with the egg allergy, they could either do an elimination diet where they remove those things, or there's actually testing now. So there's a lot of things that can be done to look into and hopefully help pain.
Yeah, beautiful, beautiful. I can't agree more. And I actually studied homeopathy for a while too. I never finished my certification, but it was something I was very interested in getting into. And it's such a fascinating study. It's amazing how something that has no molecule left of the original substance can actually be like an antidote to something. It's a fascinating study. If I had
And
to
they have done studies looking at, certain homeopathies, and they've done studies comparing, straight, medical therapies versus medical with homeopathy, and finding improved outcomes. And then they've done even, it is interesting how you don't quite know exactly how it works, but scientifically it is shown to work. And they've done it even in like plants and animals, and it's effective. And they've even done some studies where at the level of gene expression, they've seen that homeopathy can alter gene expression beneficially.
Yeah, it's amazing.
It's amazing.
Cool. Nina, what'd you have to add?
Oh, yes. I just wanted to add on to, because I did hear Dr. Tsai mention suffering. That's something that I also share with my clients when I explain to them how this whole big picture looks like, is that your pain, you're coming to me because you're in pain. I show them this graph where the bottom line here is the time or your age, and then the y-axis, the one here, is your symptom or whatever it is. Is it pain, or is it incontinence? I deal with pelvic health, so incontinence or constipation. So I explain to them that, as you age, there might be some events that happened in your life that contributed to your pain reaching this one line over here, which is your threshold for your pain or your symptom. So you take a look at that and then find out, okay, maybe you gave birth. I mean, that's a traumatic event in itself for our pelvic health, for our pelvis. So we say, I show them how these events can contribute to how you're now having this acute pain. So going back to the lifestyle factors, how do you manage that pain, being you're in that threshold level? What are the things you do? Maybe it's therapies, maybe it's some people do stress management, whatever they do, yoga or Tai Chi or nutrition. You look at that so that you calm down and manage that, and you're not at that threshold level. But sometimes another event happens, you're moving or you're empty nesting, then it comes back to that threshold again, and then you have that acute pain. Your brain is now saying, or your mind, I should say, your mind is giving you that alert or that warning. It's technically, I say, to Dr. Tsai's point, is that it's actually your friend. Pain is your ally that gives you that signal to pay attention to what's happening outside, to dig deeper. We'll look at your stress, look at your sleep, look at your energy level, how's your hydration, nutrition, and all that. So I just wanted to put that out there, because when I heard about suffering, it's huge. That trauma sometimes is what makes this situation chronic, and looking into it and then figuring out what else can be done in order for you to live with this chronic pain and overcome this pain, so you can continue to do what you value the most. So that's it. Thank you.
Absolutely.
Thank you. I also wanted to add on to, thank you, Nina. That made me think of the other part is the toxic bucket. So it's like toxins.
I think Karan is great.
Huge issue.
Yes.
Toxins, environmental toxins are a huge issue. We're exposed to so many pollutants and heavy metals and things like that. So in terms of the healthy functioning of the body, that would be a big issue to, as part of the history, figure out if someone's, exposed to any toxins. Because if you think of it, our level, say we have a bucket. So it's like you can function because your body's pretty amazing. Like it can detox through your skin, through your sweat, through your lungs, through the other way. So it's like you have this bucket, but it's like led the environment, right? We're just exposed to so many toxins. So that's another way that that people can help themselves, is learn about the toxins we're exposed to and decrease that. And that could be the tip off for the bucket. Or even food sensitivities, like whatever food sensitive, like I know when I eat dairy and gluten, it can trigger a migraine. So it's like that idea of the toxic bucket. So Nina kind of reminded me of that. Either remove what's coming in, support the detox. Those are all super important.
Absolutely. Karen, did you want to add any of that?
I laugh just because like our minds, I could see us like on the same wavelength here. So as Nina was talking, I was like, "Ooh, you know what?" Because I talk about the toxin bucket all the time, and like Dr. Tsai says, we're born, babies are born with over 270 something toxins already in core blood. So mommies are very toxic. It's not babies are toxic, it's mommies are passing it on. And so as that toxic bucket fills, once you get to the top, if you've got more toxins coming in than you have going out, then it's very difficult to deal with these toxins, because what the toxins do is you also have more toxins going into the cell than the cell can get rid of. Because as the toxins go in, they damage the mitochondria. And you need the mitochondria functioning for all these biochemical reactions so that we can naturally detox. So yes, the body's very wise, but over time, the body has trouble detoxing. And at best, it's getting downstream toxins, but not the ones that are packed away in the nervous system, which like, even like when we talk about the gut, there's so much here. We could do an 8-hour roundtable on this. Seriously. It's like all this stuff is coming up, and I know it is for everybody else. I'm like, oh, this. But like, if you just think about Candida, most of us is like Candida, Schmandida. Yeah, I'm not giving up my cake, right? But if you have an overgrowth of Candida, you may not know that. But Candida creates a biotoxin. It creates a gliotoxin. And it can literally cause inflammation in the nervous system and in the brain. And so you may be having chronic pain that's showing up in your gut, somewhere else, because the nervous system goes everywhere. But you've got Candida that's creating this excessive biotoxic environment in your body. So this is why when we talk about lifestyle changes, it's not just, like a lot of married couples say, yeah, like we say, I love you. Does it really mean anything? Like we say it so often. And so it's kind of like that with lifestyle changes. We hear it all the time. We hear diet all the time. We hear detox all the time. But when you really get to the why would I give up my chocolate cake? Because for me, it is not chocolate cake, it's potatoes. And I don't care if I eat organic, non-GMO, perfectly grown potatoes in the best soil. I'm going to have pain if I eat potatoes because I'm not healed yet. It takes a long time. It's not like you can do this in 90 days or 6 months if you've been dealing with this your whole life. You don't get sick and non-functional overnight. It's always gradual. There's always been something going on in the background we don't know about. And so it takes a long time. It's like layers that we're getting through. And so I would say that when people are doing all these therapies and when they're detoxing, even though you have some continued pain, you have to look at the progression. Am I progressing? Am I worse than I was a year ago? Or am I better? Because a lot of people give up when they don't have the vitality that they would like to have in the period of time they wish they would have it. And the only thing I can say is that I am living proof that if you keep going, it does get better. Because there was a time when I could not lift this arm and I could not have my hands anywhere there was ambient air because I had chronic regional pain syndrome. And even light touch on my skin was that felt acute. It was really not good pain. And it took almost 4 years. Now I had a pretty serious injury. My spinal cord was damaged. So this is not typical for most people with chronic pain. But my point is that I was told I would probably always have that pain, and I probably would not be able to write again because I couldn't use my fingers. Well, I can write, and I still have some pain. If I hit my elbow where I've had surgery, I'm definitely going to feel that pain. But I've also learned to do this thing where I've reframed how I look at this pain. The pain comes, I don't immediately feel like, oh, this is attacking my body. Somebody's got to fix this for me. I have a lot of things that I do on my own at home now. And if I can't relieve the pain, then I go see a practitioner. And they always are very good at helping me relieve pain. But it's not something where I immediately feel like, oh my God, there's something wrong. This is going terrible. I know that I'm being told I have pain somewhere. Either it's a remnant of what I've overcome and it's going to go away, or it's something else that I need to pay attention to. So I think that the toxin bucket is a good analogy, but as Nina was talking, I'm thinking about the pain bucket. You know, we have all these things that get stacked over a lifetime. And it's kind of the same thing that we kind of need to do is we need to lower the whatever the signaling is for that person that causes pain, whether it's emotional or physical.
Totally agree. Nina, did you have something to add?
I know, just real quick. We can go on and on, right?
Yes, absolutely.
It just reminded me of another analogy or another image in my head, the timeline. So that if I know some of you might be familiar with it, the illness to wellness continuum, where, well, in our case, for example, if you're coming to me with pain and pain is in the middle, you track what's going on with your life. If you do something positive, you go +1 towards the wellness continuum. Because it just came to me when Karan was mentioning about progression, and you know, when are you getting worse or are you getting better? So those lifestyle things that you're doing or digging deeper into what's contributing to why you're going towards the illness end of the continuum versus the wellness end of the continuum, that's kind of another way to motivate yourself to say, okay, what are the things I can do to go towards that end of that spectrum versus that end of the spectrum? Did I sleep well? And then, do I have pain today as much as I had pain yesterday? Or you know, so that's kind of same thing with constipation, guys. Did I drink enough water? Did I eat well? Did I rest and recover as good? But anyway, that's it. I promise I kept it short.
Thank you. Well, so this is a really good segue for me to talk about my story. Many of you may know, and those who are watching, you may know that I used to be a computer programmer. And when I was 18 years old, I had 12 amalgam fillings put in. So I had a lot of mercury exposure all at once. It wasn't like it was progressive either. It was, they did one quadrant at a time, and I had then 12 amalgam fillings. And I started having all kinds of health issues, and one of which was pain. And I had like a lot of neck pain, and just I had big knots in the back of my neck and all kinds of stress and things in my shoulders, which most of us carry things in our shoulders and neck. But I think it was made worse because of the mercury. Along with a whole lot of other things. I had fibromyalgia and chronic fatigue and digestive issues and immune issues, and it just all kinds of things. And so I went on this journey of trying to figure out, well, how do I make things better? Including both of my kids were, of course, exposed to the mercury as well, because I got pregnant with them in my mouth, and plus all the exposure, you know, that you just don't get rid of that stuff. It doesn't go away very quickly. It's a lifetime experience trying to remove a lot of these heavy metals, and which is why I'm such a big believer in detox and nutrition. When I did only nutrition, I only got so far. Having good nutrition did not necessarily help me do any detox. It stopped a lot of the burden from coming on. But I had a whole lot of work to do to try to work through, and I'm still working. It's still a work in progress, trying to get the toxins out and get my body into a really highly functioning state. And I feel better than I probably ever felt in my life, even as a teenager, which says a lot of things, but I also realize how much further I still need to go. And so I totally agree with everything you guys are saying. And it was no one magical thing that has helped me along the way. But I will say the one thing, and the reason why I'm such a believer in addressing the mental, emotional, and spiritual, energetic aspects of things is because I see you all shaking your head and you've all seen this. Because that is such an unseen block. So many people don't realize, they think, oh, I'm in pain or I have this physical condition. They don't realize that the way they think about it can stop them from healing. The traumas they've had in their lives can stop them from healing. It could just be that they're out of alignment some way spiritually, or it could be an energetic thing. That's keeping something, the block to the cure. In homeopathy, they call it the block to the cure. And what I love about homeopathy is they go in, especially constitutional homeopathy, they go into your main distortion. Basically, we're all distorted in our thinking, and they go into what is your main issue, what distortion do you have, and how do you see the world, and that's how they help treat you as well. So I'm a big fan of all of that. But it's so important to see these things and to address them and make that a part of your whole experience. Because a really good example, and I was telling you guys before we got on here, I wanted to talk about this one client of mine who she had never had energy healing before, and she was in her 30s, and she came in with severe sciatica. She could barely walk. And so I got her on the table and started feeling into the pain, and immediately felt like somebody was a pain in her butt. Because that's where the majority, of course, when you have sciatica, that's where you feel it. And so we dove into that, and she's like, it's my mom. And I was like, yeah, well, moms can do that. And what happened was she had not really talked much with her mom, and then her mom stayed with her for the holidays. And ever since her mom stayed with her, she had sciatica. So we worked on talking through. She would just talk it. I'm not a talk therapist or anything like that, but it helps to express the things that are bothering you, to actually say it out loud, to bring it to the surface while someone's giving you energy healing is really helpful. And it helps move the energy that you've been holding on to. So she was trying to connect with her mom again. She was trying to be in a loving state, but she was repressing a lot of her anger and frustration, and it went right to her rear end. That's where it went. It got on her nerves. Her mom was on her nerves. And but once we worked through that, she got off the table. It was, I think she said it was around 70-75% better. She came back the next week, and what came to me was it was a love interest, like something to do with a partner or something. She's like, oh, I know what this is. A year previous, she had broken up with her significant other. And what happened was she noticed twinges back then, but she didn't think anything of it because she wasn't in a lot of pain. She started getting those signals, right? Something was wrong, something's wrong, something's wrong. But, it wasn't painful enough. She wasn't in enough suffrage so that she could make a decision to do something. So it didn't really hit her until her mom came along and got really on her nerves. And then it all blew up. Once we dealt with, in that session with the significant other, she walked away, hasn't had a problem with it since. So it took 2 sessions of energy healing to work through something she had been dealing with for months. And well, really for a year, because it started with the twinge previous to that. So that's why I was saying, when Nina was talking about the, acute versus chronic, a lot of times what we think is acute is really chronic. We just don't know exactly when it started, and we aren't even thinking about it. And it could have been years previous that the real unfolding started. And but what I love about all of this is it wasn't just energy healing that helped me. I've done a lot of different things, and I'm still doing a lot of different things. I've done the homeopathy, I've done the food, I've done the supplements, I've done pulse electromagnetic field for certain pain issues and digestive issues. I've done massage therapy, physical therapy, CranioSacral, chiropractic. I've done it all, which is why I love so much of everything that we're bringing to the table, because there are so many great answers for people. And there's no one method that has the answers for everybody. And what I love is the team approach. I love that here at our center at Nourishing Journey, we are able to really bring forth this magnificent array of different modalities and possibilities for people. And if you're not into energy healing, you might very much be into the detox side of things, or you might be into the CranioSacral, which is also part energy healing, but it's a different way of doing it than I would do it necessarily. there's so many different options that you can do to get your energy moving. It doesn't have to be going to like a hands-on healer or a Reiki practitioner or something like that. It could be acupuncture. It could be, so many different things. Tai Chi, Qigong, so many possibilities. Karen, did you have something to say?
Yeah, I just, you are so good at the metaphysical aspect of healing, Jen. Like some of the stuff you got to, she got to something for me that I'm not sharing here because I've never shared it with anybody, but it's something I did when I was a kid that was a really horrible thing. And I just still didn't know why I did it, but we got to why. But as you're talking, I just had another memory. So I had to give just a tiny bit of background. So I do human design, and in human design, you have a specific auric type, and specific auric types need certain things. Okay. So I happen to be a projector, and projectors really are not supposed to speak and guide people unless they're invited to. And so the only way we get invited is we have to be recognized. People have to recognize something in us. And so I've always had a problem when I do something really good and I know it's good and I didn't get a pat on the back. And I just had this flood, and it came from the session I did with you, Jen. When I was little, really little, I choked on one of those huge jawbreakers. And my dad turned me upside down and pounded the hell out of my back to breathe, because I truly couldn't breathe. Well, that's a sensation I would get when I would know that I did something really good that could be really helpful, and I didn't get the recognition. It's like I'm realizing now I associated that pat on the back from my dad, which was rather aggressive, but I probably was equating that to this recognition I wasn't getting. And then my throat would close up and I couldn't speak up for myself. And so I'm just now, because of what you said, connecting that to that years of hurt that I had, where I knew I had a great idea. I knew I could see things, but people didn't recognize it. And so it's just amazing as we get older and we go through these things and we can go back and grab something from our past and realize, oh, this is why. This is why. There's not really anything wrong with me. I just had this hiccup and it changed how I perceive things. And it's amazing. And Jen, you are awesome at getting to the bottom of those things.
Yeah, well, I mostly because I had to go through it myself. I had a lot of traumas growing up. I had a whole lot, and some as an adult too. But the ones growing up were pretty significant for me. And one of the things that my very good doctor had recommended for me, he's like, Jen, you're not going to get better till you deal with the traumas. And it was a big eye opener for me. And so I did. I went and I started working on the traumas, which is how I got into energy healing, because it was the energy healing that helped me the most. And there are a lot of different ways to address trauma. But the energy healing really did it for me, and it moved things. So it's one thing to go to a talk therapist and to express, and that's an important piece of things, being able to express what you've been through and the victimizations you've been through. We've all been victimized, right? And some definitely a lot more seriously than others. But we all have those victimizations, and we're meant to. And that, talking about like archetypes and things like that, we are meant to experience the archetype of victimization. And how you overcome it is how you overcome the situations that those victimizations created for you. So a lot of times it does turn up as pain in people, and which is why I'm bringing it up, because the traumas we've been through, we hold them in, and we just have to keep living. We have to move forward. And a lot of times there's nothing we can do about what happened. There's nothing in the world that can make it right. There's no vindication. Even if it seems like there could be on some level. Let's say you take somebody to court and you win or something, you have those experiences and it might help a little bit, but you still have the aftermath of whatever that victimization did to you, even if it's something that somebody said about you, and what people are dealing with. And, we all have our stories. But in some way you have to get past it. You have to overcome the need for the vindication and the need for, the pain that experiences, that emotional pain that then creates the physical pain or other issues in your life. And when you can talk about it and get energy healing that surrounds it and the energy helps it move from the body, and it helps it release. And it's just amazing. You know, every day I get people coming off my table saying, I feel so much lighter. I feel like I just dumped 50 pounds of baggage. And it's amazing how their bodies change, right? But that alone is not usually the only answer. It's usually, okay, so now that mental, emotional, or trauma piece or whatever is done, okay, now we need to figure out how to heal your gut, or we need to, you know, get you into some sort of physical therapy or something where it can rework the physical tissues. But a lot of times, you know, it goes like this. You need both, and a lot of times at the same time. You need the unseen and the seen together in the same place. Go ahead, Nina.
Yeah, this just makes me think of a story, the quicksand story, where when when you get stuck on a quicksand, how do you get out? So it's almost like, you know, if you fight and you push and you move your legs and try to get out of it, you're really going to continue to sink. So the way that I'm thinking about what you're sharing with us is that, you know, with a quicksand, you really want to let go. You want to let go. You want to spread your arms and your legs so that way you'll float and come back up. And then that way you can get out of that quicksand. So it's similar to a concept that I was, you know, I shared with you guys about acceptance and commitment. It is part of one of like behavioral therapy approaches, but it's just, I just happened to think about that metaphor when you shared about energy and how, you know, being able to come out of that first, and dealing with that trauma and getting out of that quicksand, ideally by letting go, is very, very powerful before healing, further healing can take place. So I just wanted to mention that.
I love it. Thank you. Yeah. And I want to say real quickly with that, one of the things that I often talk about with people is what you resist persists. So whatever it is you're in resistance to is going to keep showing up and keep causing suffering. So you need to look at what you're resisting as a part of all of this. Go ahead, Alice. Oh, you're on mute. Thanks.
Okay. So while you were sharing it, it also made me think it's so true, like traumas. So that could be like a whole nother discussion next time.
Yes, I agree.
but with trauma, there's this thing called ACEs. I don't know if you guys have heard of that. It's adverse childhood events. Mm-hmm. So there's some recent studies about where they look at adverse childhood events and then how they correlate years later with autoimmune disease, a lot of adverse outcomes that are related to adverse childhood events. So it kind of reminded me of that we really have to, when we're treating anything, it's really important to consider the whole person, mind, body, and spiritually. That's a very, very important part of it. But luckily there's hope, you know, that it's not like this past. I mean, I think the Japanese have a very, I forget what it's called, but it's like when the cup breaks, like they repair it with the gold. So it's kind of like whatever trauma, we've all had traumas. So definitely agreeing with you there. But I think when I look back, you know, that they're painful, but then when you look back, I've learned things, you know, from them too. So it's like, how can we, I feel like that's where the timeline that Nina was talking about is so beautiful too, to really understand what's going on is, you know, what's your whole story, and you know, what contributed to it, and maybe things that, especially for children, you know, things that when your brain, it's interesting how everything interfaces, but like your nervous system and the way your brain and cognitive function is really different when you're a child. So if something happens to you when you're young, it affects you a little different. It also affects if it's like an acute thing versus if it's like complex PTSD. There's this thing called complex PTSD where it's kind of ongoing. But it's like I think our our bodies try to adapt. So we may adapt ways to try to cope that may not be functional, kind of like Karen's story of like she didn't even know, but then if you realize it, then you can really love that little child. You could be like, oh, but now I'm still acting like this decades later. It's like, but maybe we can change it. So, but then so the ACEs thing is kind of what I wanted to bring in.
Yeah, that's a great ad. Yeah, definitely. Yeah, and you know, I think it was Karen that was saying it all kind of keeps adding up, and then Nina added to that, if I remember correctly. I think about it like what we say is like a bucket or like a bank account, and you know, where is your balance? And so much of the idea of lifestyle medicine or mind, body, spirit, it's about balance and it's about alignment. And I think the last thing I would like to say about this, it's also spiritual, in that, you know, a lot of what we go through, I say everything is spiritual. You know, it's always trying to show us something. It's trying to help us learn something. It's trying to help us overcome something. There's always something spiritual connected to what we're going through, because we are spiritual beings in this human experience. And if we can get to the reason why we're experiencing something, that can also be a really important factor. So if you're experiencing pain, maybe it's meant to get you into some sort of, like for me, you know, it got me into a whole different career. There could be a calling in there for you, or it could be you're meant to figure out something to help somebody else, but it's a part of your spiritual path to do that. But anyway, so I just wanted to add that real quick. Go ahead, Karen.
When you're talking about body, mind, spirit, I mean, I've kind of really, even since I was a nurse, I understood that because I worked hospice. So I learned a whole lot about that. But after my illness, and what I teach my clients now, particularly ones who are not real in touch with the spiritual aspect of healing, is that I think it's backwards. I don't think it's body, mind, spirit. I think it's spirit, mind, body. Mm-hmm. Because when we have a hiccup with the spirit, we will have an emotion that will go with that, and that goes directly to the mind. And then the mind will do all the things with it. And we're typically trying to recreate an experience that felt good, or we are trying to avoid an experience that did not feel good. And human design teaches you all about this with the mind, and how the mind is really a pitiful master. But, you know, my thought was that then once we do that, we create all of these neurochemicals that don't really need to be created. And then the body is where the end product of that disruption of spirit starts. And it typically does start in childhood, sometimes even in the womb, because it's an ancestral thing that we bring in. So it is a complicated, it's easy, but it's also these complex layering of things that we really have to be willing to jump into this abyss to unravel if we want to be vital and healthy. And even though there are times it doesn't feel pleasant, there's also these, like just that little breakthrough I just had. It's amazing that I just had that from, I didn't expect to have that. I had put that together before. And it's like, wow, now I know why my throat closes up. Recognize. And it's usually by females, because my mother didn't recognize I was choking. My father did, and he saved me. And so so that's why I've always looked to men probably to save me in those situations. So it's very interesting how we can start to realize that as a child, we don't have the capacity to really understand the bigger picture. So we have to, you know, like Dr. Tsai was just saying, as a child, we have to create these situations in order to cope. And once we start unraveling all this, we realize that maybe there's not as much to cope with as we think there is. We apply a whole lot of really important things to things that might not be so important.
Perfect. Yeah, well, I think we're going to go ahead and wrap it up there. It's been about an hour. So for any of you listening, if any of this seemed helpful for you, or if you're dealing with any type of pain, or if anything else we said here is interesting to you and you think we might be able to help you, we are just 5 of the practitioners at Nourishing Journey who can be of service to you for so many different ways. And if there's anything that you feel drawn to, there's information in the description and you can figure out how to contact us. And we will approach things as a team to try to figure out how to best help you and to really get you feeling good again and to figure out what's going on. So if it sounds interesting to you, please definitely contact us. All right. Thank you so much, everybody, for joining today. And I look forward to having more of these in the future. Thanks, guys.
Thank you.